For 2 years, I did not need any of the intravitreal shots. After the 2 years, I started receiving the shots. There's a lot that goes through your mind at that point, just having somebody put a needle in your eye. At that time, there was also fluorescein angiography, and I had to go through that process. This was about 19 years ago. From that time on now, I have been receiving the shots for 17 years, every 4 to 6 weeks or 10 weeks. It seems to have progressed to a point where I've gone from myopic macular degeneration to dry and now to wet. But also things are changing along the way, and the extension of my leaky blood vessels needs a shot usually every 10 weeks instead of 4 to 6.
Patients with macular degeneration were like a bucket with a hole in it. They could only lose vision for a time, maybe preserve it with the available therapies, but not really have any hopes of getting more water or more vision in the bucket. Anti-VEGF therapy changed all of that, and now it's become, for many patients, a treatable disease. Anti-VEGF therapy is the use of drugs that block a molecule called vascular endothelial growth factor, or VEGF, and blocking its action on blood vessels in the body. VEGF, the naturally occurring substance in our body, has many actions, some beneficial and some detrimental. One of the actions VEGF has is making blood vessels leaky. So if you can think of pipes that are old that may be staining the ceiling as water is dripping, this is an action that is done by VEGF on certain blood vessels in the eye. The use of an anti-VEGF restores the integrity of those blood vessels and fights the leakage and therefore the resultant fluid that damages the retina, whether it's in wet age-related macular degeneration or diabetic retinopathy. Anti-VEGF therapy is one of the, if not the biggest revolution in retinal care in my career. The only other one that would come close would be the application and use of vitrectomy surgery for conditions within the eye. We had therapies that might be able to slow it a little, but we didn't have any really effective treatments to preserve or restore visual acuity.
My visual acuity is, the last time it was checked was 20/40, which that has not been in a while, in my left eye, and my right eye fluctuates between 20/50 and 20/70. So reading, I can read with reading glasses, and I probably should mention that I had cataract surgery also, and that has helped a little bit. Although one of the doctors did say it's a treatment. It's it's not a cure, but it will help me to see better.
The impact of anti-VEGF medications on the quality of life of patients with age-related macular degeneration, diabetic macular edema, retinal vascular occlusions is enormous, absolutely enormous. And let's put it in practical terms. We all fear blindness greatly because it's a tremendous limitation to normal activities. For example, imagine trying to go to the grocery store. You're an older person living alone. You need to buy eggs and milk and other things in order to make your meals. Well, let's say you, number one, are having difficulty cooking, and number two, you can't even get to the grocery store walking those 2 blocks safely because your vision is impaired. You can't read the labels once you're there. You can't check the prices. Now you get an anti-VEGF medication and your vision is improved, and suddenly you can say to the butcher, no, I don't want that cut of meat. I'd like the other one on the right side of the case. And you're back in life. How wonderful to be able to participate in the day-to-day activities that make our lives so rich and so meaningful.
I do still drive, so that's a huge help as far as in the way of independence. I like to read, I like to hike. I feel very good about where I am in comparison to where I was. If I had not had the shots, some of my optometrists and other doctors have said I may have lost the sight.
Prior to anti-VEGF therapy, wet age-related macular degeneration had very poor treatments. I remember I was a fellow at Bascom Palmer Eye Institute in 1982 when the first macular photocoagulation trial results were released. In that treatment, we attempted to burn the new blood vessels to prevent them from reaching the center of vision, that is the fovea. We had literally nothing. Since that time, a number of treatments were introduced. There was photodynamic therapy, which had some benefit, introduced in around 2000, and then drugs that could slow the loss of visual acuity, but not really improve it, really until the introduction of anti-VEGF therapy. Similarly, with diabetic retinopathy, we did have laser treatment, but no way really to address diabetic swelling in the macula or macular edema. But now with anti-VEGF therapy, we have a powerful tool, and we can reverse the swelling and improve the acuity for many diabetic patients. For example, a patient with wet age-related macular degeneration, obviously typically an older patient, who's looking forward to many of the wonderful things that older age can bring, putting photos in albums, reading to grandchildren, taking trips with loved ones to see loved ones, etc. And they're quite concerned when their vision is threatened. So I say that we will begin a treatment. Yes, it requires an injection into the eye, which sounds really scary at first, but actually it's over in a couple of minutes and has become one of the most common procedures in all of medicine.
Yes, it's scary, but once you've gone through it, you realize that you don't feel it. People often say, oh, an injection in the eyes. Well, I do know about the numbing process and all of that. So you don't feel it. And I often say to people, if I pinch them, that would hurt more than when you get the injection.
And that this treatment has the strong prospect of stabilizing or even improving their visual acuity. After that, I don't find a lot of patients anymore who resist the idea of the shot. They're actually quite eager to get their vision back. And so some patients will require shots every month. Some patients will require shots at lesser intervals. But I would say that people are generally quite enthusiastic about the fact that there is a treatment.